the participant observation in health center and interaction with care provider and patient by 4 assistants who is trained in anthropology and sociology. In-depth interview were conducted who had an abortion experiences. The data was analyzed using DDoS and using deductive and inductive approach. This study highlights the complexity of decision related to unintended pregnancy, influenced by a variety of social, economic, cultural, and relational factors. The analysis focused on the reason for maintain unwanted pregnancy. The second is the motivation for choosing abortion. Last one is professional aspiration as an influence factor. We have partner and relative significantly impact decision, either supporting or opposing abortion. We have instance of productive coercion by partner or family members. The decision to seek an abortion among women and girls in Benin is shaped by a range of complex factors. The economic, social, and cultural pressure, stigma, unequal gender norms, and power dynamics. Challenge despite legal change. It's right that Benin have a progressive law in abortion today. Abortion law have recently been amended. We have also health risk. These challenges increase the likelihood of young women resorting to unsafe abortion. It is essential to create intervention that respects reproductive rights, expand access to safe and legal health care. We have to launch community awareness campaign. We have also to focus on alleviating social and gender-related pressure surround abortion and ensure continuous training for healthcare provider on abortion service. Develop a referral system for cases of conscientious objection among provider and enhance educational programs on reproductive health and contraception. Thank you very much.
A holistic approach to responding to the cervical and reproductive health needs during protracted and emergency crisis in Afghanistan. And this paper is by Saber M.N., Khande R., Shaikh T., and Samin N. And the presenter will be Tayaba Ki. Anyway, she is a public health expert with over 16 years of experience in designing, implementing, and evaluating health and development programs. She holds a PhD in public health and a master's in population studies from the International Institute of Population Science. Dr. Shaikh is passionate about advocating for the health rights of marginalized communities, focusing on women, adolescents, and children's health, HIV prevention, housing and sanitation, and sexual and reproductive health rights. She has worked in various national and INGOs. Since 2021, she has been associated with the International Planned Parenthood South Asia Region SARO office, where she plays a key role in supporting member associations in advancing regional health initiatives, fostering collaboration to improve sexual and reproductive health. Over to you, Dr.
Thank you so much. Good afternoon, everyone. This presentation was supposed to be done by Mr. Sabir, associated with Afghan Family Guidance Association. I'll be presenting on his behalf. The topic is a holistic approach to responding the sexual and reproductive health needs during protracted and emergency crisis in Afghanistan. Since many decades going through protracted crisis, they have been experiencing the climate change. This is just a learning from one of the interventions which AFGA has been implementing. Objective and the aim is to enhance the access to the essential services to the hard to reach population and in the remote areas. The aim is to strengthen the health system, empowering communities, especially women, girls and adolescents, to access these essential SRH and MISP services. Actually, the method and methodology is just the strategy, how they are following it for implementing the programs in both the situations. AFGA, they deliver actually the SRH and MISP services through their established static clinics, family health houses, mobile clinic, community outreach midwives. Around 150 midwives are trained in providing SRH services. During the acute crisis and emergency situation, AFGA, they basically collaborate with UN and humanitarian agencies and provincial health departments to conduct the need assessment. They plan the implementation, and in collaboration and partnership with all the NGOs, they implement the program like in a collaborative effort. They always use the mobile clinics and satellite clinic model. The affected areas are far away from those clinics, so the accessibility is difficult. The program data which they maintain in DHIS2 tracker. For some of the impact indicators calculation, they have used MSI impact tool. They do have a robust tracking of service utilization health outcomes. During the protracted crisis, like from 2021 to 2023, they have been able to reach to 1.7 million clients, delivering the 7.4 million services. During the sudden onset of crisis, over 85,000 clients, including 12,735, they've been provided services. They have also provided service, identified the complicated pregnancies. 33,939 clients received short and long-term, long-acting reversible contraceptives, able to generate 220,000 CYPs, 100,000 unintended pregnancies were aborted, and prevented 43,696 unsafe abortions. 134 maternal deaths and 870 child deaths were averted within 3 years. Community-based outreach program, they could save 3.8 million pound in direct healthcare costs. They have been providing the comprehensive SRHR services and MISP services through the community outreach model. Timely implementation is one of the vital component. Once the onset of a crisis happens, they will implement the response program. They just link the community to the nearest facilities. Strategy they are following for sustainable.
Next presenter is Sitmi Attanayaka, and she is going to present on exploring cultural, religions and legal barriers obstructing access to safe abortion in Sri Lanka. So that's the title of her presentation. And Sitmi holds a BA Honours in Sociology from the University of Peradeniya. As a dedicated youth activist, she has actively engaged with several non-governmental and international organizations in various roles, including volunteer, project coordinator, project consultant, and educator. Her international training in SRHR further inspired her to pursue research in this field. Additionally, she has served as a research assistant at the University of Peradeniya, contributing to a collaborative research project with University of Birmingham and the University of Colombo. So with that, I call Sitmi to make her presentation. Over to you, Sitmi.
Thank you. Good evening, everyone. I'm a graduate from University of Peradeniya, and I'm lecturing for Royal Institute Gegoda, affiliated with the University of London as a sociologist. My today's topic is exploring cultural, religious, and legal barriers obstructing access to safe abortion in Sri Lanka. Objectives of this research, it is to identify and explore the cultural, religious, and legal determinants that act as a barrier to obstruct accessing for safe abortions in Sri Lanka. I used a qualitative research approach. I didn't want to go into quantitative information because it's about socially constructed determinants. I used a purposive sample because I used semi-structured interviews. I used thematic analysis where I can identify proper patterns and different new themes. I identified there are determinants which are socially constructed. Those determinants act as reasons for barriers. There is a huge influence of cultural and religious beliefs that influence women in accessing safe abortions. Buddhism, the first precept says killing a living being is a sin. They considered it as a murder, as a killing a living being. And also the gender roles. Most of these decisions made by the wife was kind of influenced by the husbands. Not even for abortions, but even for sexual activities, there are a lot of restrictions for women to go into the society and act premarital sexual relationship. There's a family pressure coming from the families, like especially about virginity of the girl and all those things before marriage. Social media has a huge influence. There'll be so many negative comments coming from the society. Even in school, even my experience, asked teachers skip the lesson, like went faster, like fast forwarded the lesson, and then it was not properly given, like properly educated. The sexual hygiene can be a point of it, and how cultural sensitivities can make people aware of using contraceptive. Law is the big determinant that obstruct access to safe abortion in the country. It was during the British colonial period and not have been renovated. Safe abortions are not allowed in the country. 11.7 maternal deaths happened due to these unsafe abortions in Sri Lanka. According to 2016 findings of the Ministry of Health, between 550 to 750 abortions take place illegally in unsafe methods. I think law plays a major role in the abstracting act for safe abortions in the country. Conclusion is, again, these cultural, religious and legal determinants create significant barriers to accessing safe abortion services in Sri Lanka. When these people don't go into safe abortions, they go into home remedies or some unsafe method. They won't get the post-abortion care. My recommendations are, so there should be culturally sensitive sex education in school. So culturally sensitive as in it should be all inclusive. Those are not being addressed. And there should be proper, rather than just displaying the women's sexual system and then male reproductive, the penal code probably should be amended. The economic disparities where they can't afford contraceptives and ground level initiatives, they are not aware and they don't have access to this information. And also social media and mass media, there should be some open space. Thank you so much.
Tamasi Konara is the next presenter and it will be a virtual presentation. She's a MPhil and PhD candidate at the Faculty of Law, University of Colombo, Sri Lanka. She holds both a Master of Laws and a Bachelor of Laws, LLB same, and currently she is a probationary lecturer at the Faculty of Law, Sir John Kotalawala Defence University, Colombo. Over to you for your presentation.
My name is Nadana Konara. I'm a lecturer attached to the Faculty of Law, Sir General John Kotalawala Defence University. In today's conference, I will be presenting on the topic of shattered consent, reproductive autonomy, and the legal challenges for rape survivors in Sri Lanka. The research problem that I am addressing today is, in Sri Lanka, abortion constitutes a criminal offence under Section 303 of the Penal Code. The only exception that is provided is for the purpose of saving the life of the mother. So, other than for the medical reasons of the mother, abortion is not permitted in Sri Lankan context, and being a rape victim is not an exception. My research is going to be focusing about the violation of autonomy. The objective of this research is to address this issue. So, I will be analyzing the current legal framework and its effect on the survivors. The ultimate objective of my research is to recommend legal and procedural reform to the Penal Code to respect and protect the rights of the victims of rape, to ensure their well-being and their rights. I restricted my research to a qualitative research methodology with reference to the doctrinal research methodology. The sources of law, which included mainly the Section 303 of the Penal Code, international treaties which says, whoever voluntarily causes a woman with a child to miscarry, if such miscarriage be not caused in good faith for the purpose of saving the life of the mother, will be punished with the imprisonment of either description for a term which may extend to 3 years. Simply states that abortion is allowed only in the times of medical conditions for the purpose of saving the life of the woman. Section 363, as amended in 1995, rape is defined as a forced penetration by man towards a woman without a consent. If a rape victim is pregnant, she is being compelled to carry out the pregnancy. There has been attempt to amend the existing legal clause to allow rape victims to go through a medical induced abortion, but it was a failure. In 1997, there has been a research done on the impact of Section 303 on the women's rights, but it doesn't specifically address about the rape. So the rights of the reproductive health simply state as the physical, mental and social well-being in matters relating to reproductive system, which comes with the right to decide whether to carry or terminate an unwanted pregnancy. pregnancy. You restrict someone, a rape victim, from an abortion, it affects multiple human rights, including right to life, right to health. Also, when a government is forcing someone to carry out a pregnancy, it can be considered as a form of physical and mental torture. Being pregnant means you have to give birth to the child and you are compelled to raise a child without your consent, without your need. Also, it will violate someone's right to education, right to privacy, their family life, their social life, is violating most of human rights that is being given to a female, given to a human through CEDAW Convention, ICCPR Convention, and the Convention on Economic, Social, and Cultural Rights. Sri Lanka has violated the international obligations that we have as well. Criminalizing termination of pregnancy is a serious violation of international human rights obligations. Rights of the mother should be prioritized. My main recommendation is to decriminalize abortion in situation of a rape victim under Section 303, where they are being given the opportunity to terminate the pregnancy. Supplementary measures should be taken. Thank you.